There is a moment in life that rarely announces itself. It does not arrive with pain sharp enough to demand attention, nor with an injury dramatic enough to feel urgent. Instead, it enters quietly, often unnoticed. A pause before standing, a slight tightening in the hips when you turn, a subtle sense that the body takes longer to respond than it once did. Most people do not describe this as decline. They describe it as aging. But biologically, something very specific is happening beneath the surface, long before any diagnosis, long before any fall, long before anyone calls it a problem. The human body is not a static structure. It is a living conversation between tissues, nerves, bones, and the environment. Every movement you make sends information inward. Every lack of movement sends a message as well. After the age of 60, that conversation changes tone. Muscle fibers begin to receive fewer signals to stay active. Bones receive fewer reminders that they are needed to bear load. The nervous system, exquisitely sensitive to repetition and demand, begins to prioritize efficiency over readiness. None of this is failure. It is adaptation. The body is doing what it has always done, responding to the signals it receives. What is often misunderstood is that aging itself is not the primary driver of loss. D'Souza is. Muscles do not disappear because the calendar turns. They fade when they are no longer asked to contribute meaningfully. Bone does not thin because it forgets how to be strong. It thins when it no longer experiences the gentle stress that tells it strength is required. Balance does not vanish overnight. It dulls gradually when the nervous system is no longer challenged to coordinate complex, stabilizing responses. Many people are told that movement is enough. To walk more, to stay active, and walking is valuable. It supports circulation, cardiovascular health, mood, and mental clarity. But walking alone is a conversation that lacks resistance. It tells the body to move forward, but not to push, stabilize, or react. It does not ask the muscles to generate force. It does not ask bones to reinforce themselves. It does not train the nervous system to recover when something unexpected happens. Biology is precise. It adapts to exactly what it is asked to do, no more, no less. In the later decades of life, especially for women, muscle tissue becomes more metabolically expensive for the body to maintain. Without regular signals that strength is necessary, the body reallocates resources. Muscle fibers shrink. Fast, reacting fibers fade first. Strength declines more rapidly than size. This is why tasks that once felt effortless begin to require concentration. Standing up becomes something you think about. Balance becomes something you negotiate rather than trust. These changes are not sudden, but they are cumulative. What is remarkable, and often underappreciated, is that the body remains responsive to targeted stimulus far longer than most people believe. Even into the 8th and 9th decades of life, muscle tissue retains the capacity to adapt. Bone cells remain sensitive to mechanical load. Neural pathways can still sharpen their timing. The requirement is specificity. The body does not respond to vague intention. It responds to precise demand. Consider what it truly means to stand up from a seated position. From the outside, it appears simple. But internally, it is a coordinated orchestration. The hips shift back. The quadriceps engage to extend the knees. The gluteal muscles generate force to lift the pelvis. The core stabilizes the spine. The ankles adjust to maintain alignment. The nervous system predicts the movement before it occurs and corrects it as it unfolds. This single act reflects strength, balance, timing, and confidence. When it becomes difficult, the body compensates. Hands push. Momentum replaces control. These are not moral failures. They are intelligent adaptations to weakness. When strength is restored, something subtle changes. Movement becomes quieter. Less effort is visible. The body no longer rushes to protect itself because it trusts its own capacity. Confidence emerges not from encouragement, but from evidence. This is how the nervous system learns, through repeated proof that stability is available when needed. Side to side stability is another conversation often ignored. Human walking is not a straight line activity. Each step places the body on one leg while the pelvis must remain level. The muscles on the outer hip act as guardians, preventing collapse and misalignment. When these muscles weaken, the body compensates by shortening stride, stiffening joints, or reducing exposure to uneven surfaces. Over time, this changes how people move through the world. They choose predictability over exploration, not because they are incapable, but because their internal sense of stability has eroded. Balance itself is not a single skill. It is an ongoing dialogue between the eyes, the inner ear, the joints, and the brain. The ability to know where the body is in space without looking is something learned and maintained through challenge. When this system is under-used, reaction time slows. Corrections become delayed. A stumble that once would have been inconsequential now carries risk. Falls are rarely caused by weakness alone. They are caused by timing, the milliseconds in which the body must decide how to respond. Standing on one leg may seem insignificant, yet it reveals an extraordinary amount about internal coordination. The ankle makes constant micro-adjustments. The hip stabilizes against gravity. The core maintains alignment. The brain integrates sensory feedback in real time. This is not about athletic balance. It is about readiness, about preserving the ability to respond without conscious thought. When this capacity is trained, the body regains a sense of orientation that transcends muscle strength alone. What often surprises people is how little is required to send powerful signals back into the body. Strength training at this stage of life does not need to be aggressive or exhausting. It needs to be intentional. Slow, controlled resistance tells muscles they are needed. It tells bones that reinforcement is required. It tells the nervous system that coordination matters. Consistency matters more than intensity because the body responds to patterns, not extremes. There is also an emotional dimension to physical strength that is rarely discussed. Independence is not only a physical state. It is a psychological one. The ability to rise from a chair without assistance, to step confidently onto uneven ground, to trust one's balance. These experiences shape how people see themselves. They influence willingness to engage socially, to travel, to participate in life fully. When strength fades, people often withdraw long before they are physically incapable. When strength returns, engagement follows naturally. The language we use around aging often frames decline as inevitable. But biology does not support inevitability, it supports responsiveness. The body listens constantly. It listens to load, to challenge, to rest, to repetition. When it hears nothing, it conserves. When it hears purpose, it adapts. This adaptability is not limitless, but it is far more enduring than commonly believed. There is dignity in understanding the body rather than fearing it. In recognizing that small, deliberate actions can have profound cumulative effects. In appreciating that health is not about perfection, but about participation. The human body does not require punishment to improve. It requires clarity, clear signals, clear intention, clear respect for its design. Strength, balance, and coordination are not separate goals. They are expressions of the same underlying system. A system designed to move, to respond, and to support a life lived with agency. When we nurture that system thoughtfully, we do more than prevent injury. We preserve the quiet confidence that allows people to live without constant self-monitoring. The later years of life are not meant to be smaller versions of what came before. They are meant to be different, informed by wisdom, restraint, and discernment. The body, too, benefits from this approach. It does not need to be pushed relentlessly. It needs to be reminded, gently and consistently, that it is still capable of strength, still capable of adaptation, still capable of supporting independence. In this sense, targeted physical practice becomes more than exercise. It becomes communication, a way of telling the body, with clarity and respect, that it is still needed, still trusted, still part of an active conversation with the world. And the body, remarkably, listens.